In line with the international best practices of conducting a national population housing census, the Bureau will conduct PACE in all the 135 districts and also the 11 cities across the country. The Post-Enumeration Survey is undertaken on a sample basis, and it replicates, of course, the main census activity. The results from PACE are compared with the census results to establish the variations that might have occurred during the census enumeration. The Bureau has already trained a team of independent persons at national level, and as we speak now, we are doing trainings for other people who are supposed to collect data at sub-regional level. We have 15 statistical sub-regions across the country, and this training is going to be taking place in all these regions. For census, we had what we call the reference night, the census night. But for PACE, we talk of the previous night. When the enumerator comes to your household, they will ask you, who spent the night here yesterday or in the previous night? So you will tell them. Then it will also target all persons who spent the previous night outside the household but came back late in the night. You know, you have people like who go to bars. You have someone who has gone to a function, an event, a wedding ceremony. Then members of the households who were admitted to hospital on the previous night will not be enumerated, but their caretakers who were away on the previous night will be included in the post-enumeration survey. Then also have persons at funerals. They will be enumerated from their respective households because they just went for a burial. Then we have children born after the previous night. For them, they will not be included. However, persons who were in the household in the previous night but died before the interview was conducted, this category of people will be included. And also have refugee camps. The refugee camps will not be enumerated. We have the UPDF, police, prisons, barracks. These areas, we shall not consider them for PACE. We also have disabled persons' homes. We talk of Katelemwa and so on and so forth. Those ones will not be considered. Hotels, they will not be considered in the enumeration. Then, of course, armed forces training schools, they will not be considered in the enumeration. Inpatients at medical institutions like hospitals, health centers,